Zoom it. All right, and just so we have it for our recording, I'm going to do a brief introduction again. We're welcoming Jill Mayer along with a couple students from Ithaca College to present on oncology rehabilitation, restoring function and quality of life after a cancer diagnosis. So Jill and team, I will let you take it away.
Great. Well, thank you, Jennifer. Thanks for inviting us. We're really happy to be here. It's so nice to get to come out and be a part of this monthly kind of lecture series. So some of you may have seen me before. I've come to the Cancer Resource Center several times. We've had some different studies going on regarding physical activity and cancer recovery. So we did one we came to the home, and some of our students and I Patricia, we given exercises and things in the house and ask you to try to do them over a period of time and then track how you did. And then in one of those studies that we actually did, we gave one group a phone call a week and the other group we did not. And so we just, so what we found in that study was that weekly communication was extremely important and extremely valuable. And it became a way to kind of hold somebody accountable, but it also became a good support person for the individual who was trying to carry out this exercise program while they were going through treatment or just after treatment. So, a lot of that, what we've determined from that study was that you need support kind of when you're trying to get back into exercise again, because there's so many things that can happen due to the cancer itself, due to all the treatments that go along with it, and then those side effects that last a really, really long time after. So just because chemo's done doesn't mean you're back to being 100% again. Those residual side effects we see last for a really long time. So having that little bit of guidance is really helpful. So that's sort of what we're going to talk about tonight, is just sort of what does that look like? And we'll talk about exercise and physical activity. And then, because that's a lot just where my research has kind of gone. And then we're hoping to get in another study looking at balance and trying to look at balance and how we can help improve balance during and after treatment. So that's kind of next steps. But I'll also introduce you to Megan Mendler and Lachlan Heigel. So they are both graduate physical therapy students. And I'll just have you introduce yourself, maybe just say where you're from, that you're close to the end of your program and you'll be a doctor of physical therapy soon, maybe where a clinical is or why you wanted to help with this.
So I can start. So I'm Lachlan Hale. I'm a 6th year physical therapy student. So I have been involved with Dr. Mayer in a few different oncology experiences throughout my time here, starting my sophomore year. So I was really excited that this opportunity came up to be able to speak with all of you and be able to engage with the IC community before I leave and head off into the world. This summer, I will be working at Saratoga Hospital on my last clinical. And then after that, I'm hoping to be able to find some type of work with cancer survivors and hopefully eventually specializing in this field.
Hi, my name is Megan Mendler. I'm a 5th year PT student this year, so I still have one more year at Ithaca, which I'm very excited for because I've gotten to get involved through Dr. Mayer with things like this, and I'm really excited to continue that. But I have my first clinical this summer, and it is at home because I wanted to be home where housing is free and my family is there. So it's just an outpatient. But for my next clinical, I'm hoping to go to Florida where there are more options, and I hope to be somewhere where I can help cancer patients and work more so in that. And so that's my hope for the future too, is to continue working in this field.
All right, great. And we're going to hear from them during the presentation too. So I'm going to share my screen right now so that you can sort of more easily follow along. And you just let me know if you just want to make sure everybody can see that. Good. Okay, so we also gave this presentation to Jennifer, so you can have a copy of it, and we just put it in as a PDF. So feel free to, you don't necessarily have to take notes or anything. You can always ask us questions at any time. Just stop me from talking. Say, hey, I have a question, Jill. That's fine. We'll just stop and, try to answer those questions as we go, or feel free to wait until the end. But very informal, feel free to just have a conversation throughout too. So at the end of today, we're going to be looking at what are the benefits of physical activity before, during, and after a diagnosis of cancer. We'll talk about the current exercise guidelines, and they were just updated in 2020. Understand the side effects of cancer treatment, which unfortunately, I'm sure you or family members have unfortunately witnessed firsthand or experienced. And then what would be, because of some of those side effects, what are some of the precautions and considerations that you need to consider while exercising? Then we'll talk about at the end just the PT role in the survivorship continuum and when it might be appropriate to see one. So I will refer to the term cancer survivor just because the NIH or National Institute of Health uses this terminology. So this would just be anyone who's diagnosed with cancer from the time of diagnosis through the balance of his or her life. And I understand that some people don't like this term. They either don't feel like they are represented as a survivor yet, or they want it in the past, So again, I'm completely open. So either a person who experienced cancer, please, feel free to also share what you like and what fits for you. So we've seen an increasing number of survivors of cancer throughout the years. And a lot of that is because of the improved diagnostic accuracy. We're getting better treatment, earlier treatment. We are seeing better follow-up care. We also have an aging population, and we have an obesity epidemic. And so we do know that as we age and obesity, those can all play a factor in developing cancer. So we see that also since 2012, more people are surviving cancer as well. So there's a lot of people out there who have cancer or have survived cancer, and now they're living with some of the repercussions of that. So overall, 40% of people are going to have a diagnosis of cancer at some point in their lives. That's a lot, and that's a lot of different things to consider for all of us as healthcare providers and going into this health field. So just in general, benefits of physical activity, we've heard before that actually it wasn't until really the late 1980s, early 90s, that exercise or physical activity was even good for cancer survivors. It was said to rest, right? Because your body just needs to fight the cancer, and we just need to give it all the rest we can. Well, we've disproven that actually over the last, 30 years. And the evidence just continues to keep supporting physical activity for a multitude of reasons. So basically, for everyone, we should be promoting exercise, right? So we're promoting health and wellness, and that can look and feel completely different for everyone. So some people exercise is gardening and getting outside and mowing the lawn, or just going for a walk with friends. For others, it can be actually going to a gym. Others can be swimming. Others can be getting on the bike. So for many, it can be cleaning the house, right? Like that takes a lot of the day. It's pretty taxing on the body. Laundry is heavy, and especially if you have to go up and down stairs. So you can incorporate physical activity in different ways. But what we're finding is that that if you are doing physical activity, it's beneficial before, during, and after a diagnosis of cancer. We're also finding that it's more important after than in any other time period. So if you've never exercised in your life, it's completely okay, because after is where we find it matters most. And it can be beneficial for all different cancer types across all different treatments and for a variety of their cancer-related impairments. Okay, so what we see, this is just a summary of some evidence that was found in a 2018 study. And basically, we see that exercise is associated with a lower risk of developing a lot of different types of cancer, and then also an improved survival after a cancer diagnosis. These are the diagnoses that have been studied the most. As you can see, breast cancer and prostate cancer are more well studied given the prevalence of those. We'll also see more colon and lung in a lot of cases. And we're also now being able to correlate the amount a person is sedentary with the risk of developing cancer for certain ones. But keep in mind, cancer is multifactorial, right? We did not get cancer because we didn't exercise. There are so many factors and so many reasons. So I look at physical activity as an opportunity to give us a little bit of control over the disease. And whether that means actually curbing our survival and our recurrence rates and making those better, or whether it just improves our quality of life because we're now able to do more, we can get out, we tend to be more social, and the oxygenation to the brain through exercise just really helps us feel good from a mental state and physical state. So they've been doing a lot. This is where a lot of research is being focused right now, though it is hard to capture this research. But we're looking at what's the benefit of you get a cancer diagnosis and what's the benefit of doing exercise before you start treatment, right? So a lot of people jump to, I want this cancer out of my body immediately, like get it gone, let's start treatment tomorrow. And they're kind of trying to see, okay, well, what type of cancer do you have, right? How aggressive is it? Is there a way to wait a couple weeks or a month to help get you stronger beforehand or not, right? So it's a good conversation to have with the oncologist. So for this, we're actually seeing that people who are exercising between diagnosis and actually starting treatment have overall an improved tolerance to their treatment. They see they're more adherent to exercising. They don't decline as much, right? So if we think about chemo and radiation and surgery, it takes a ton out of us. So we see them actually, rather than go from here to here, you know, all the way down functionally, they go from here to here, right? So they have these little curves down versus these drastic curves where now you're needing assistance to get up or off the couch versus before you're completely independent. We see less hospital length of stays, less complications, and a quicker return to improvement once the treatment is over. So we do see some research in lung cancer specifically. So these are for patients that were able to walk a quarter mile. So if somebody with advanced non-small cell lung cancer is able to walk a quarter of a mile in 6 minutes or less, before they begin treatment, we're actually seeing that they have a 56% risk reduction in death within a year. We're also seeing if they can do that, that there's greater than an 88% chance of survival at a year versus 67%. Because that means a person is stronger to start, right? They have more endurance. They're probably going to be able to carry out a little bit more movement and activity throughout their treatment, throughout the next year, reducing their risk of other complications that can happen from, you know, being in bed for a long period of time. And so with every 50 minutes, which is just, you know, an eighth of a mile that they can walk within that 6 minutes, we're also seeing a reduction in risk. So this is pretty cool stuff. I think that this is an area I would love to learn more about, just to have conversations with others of when is the ideal time to start treatment, depending on what the diagnosis is and how quick to start. And would 2 weeks of physical therapy or intensive PT help you get stronger, just like you do before you go to have a knee replacement, or you do to go before you have a hip replacement? It's really that same idea. It's just getting stronger before you know your body's going to get kind of hit hard. Then we're also seeing a ton of benefits during treatment. So for this is sort of the biology behind it, which I found this study really, really kind of neat. So actually the New York Times published this several years ago, and then I was able to find the study and actually got to listen to this author at a conference speak, who was just amazing when it comes to oncology research. And so what we find is sometimes the tumors can actually sort of survive in their own ecosystems. So they actually kind of create their own blood supply. They grow, and nothing can really get at it. Okay, so it like twists and turns, and then it keeps growing despite, you know, it in its own space with its own ecosystem and all the tubes and vessels and vasculature. It doesn't even need it from the body. It can just kind of keep doing it on its own. And so these tumors are really hard to attack because the treatment doesn't get to them easily because it doesn't have the typical blood supply to attack the tumor. So in this case, we're wondering, so the scientists said, all right, well, when we exercise, that improves blood flow to normal tissue. What if we exercise, during chemo and see, could that improve the flow to the tumor to help it? So they did this in mice. Most of these studies are done in mice. And basically they gave mice estrogen receptor positive and negative tumors. So they gave the mice breast cancer, essentially, and put them in 4 groups. One group of mice did nothing. They didn't get any treatment. They didn't walk. They sat there all day. The other group did just exercise, but no treatment. Then there was a group that sat and got chemo, and a group that did exercise and got chemo. And what they found was actually all this green coloring you see here, that's a really good thing. That means that we are actually causing the tumor to die, and we're reducing the size and the growth of the tumor. So they saw in just the exercise group alone, even without chemo, that there was some improvement in those and slowed the growth of the tumor. But then you added chemo to it and it made it that much better. So the chemo was better able to attack, and the tumor size shrunk significantly in this population. And so this is kind of where a lot of this research sort of comes from, is these animal studies and these biological models of, sort of the why behind it. So you're getting the tumor, you're oxygenating and sending all of the body's nutrients to fight it off to it better, because we're improving that vascularization to the tumor itself through exercise or walking or biking or swimming. Other things during treatment that are really beneficial are we see improvements in quality of life, aerobic capacity, strength, less symptoms. We see bone mineral density improvements, tolerance to treatment. And then we're actually even seeing some improvements in the cells of our body. So some of the cells in our body provide and help us with immune function. And we're seeing improvements in the immune function cells. We're seeing improved kidney function, improved cell counts. And I think a big one is just this depression and anxiety piece. And Lachlan's going to talk more about that later. But, cancer is depressing, but it also creates chemical changes. Okay. So in what we're seeing is with the exercise is that we're also able to kind of help tackle some of the mental health side effects of cancer. And then we have benefits after treatment too, right? So even for people who haven't been able to exercise during chemo, because let's face it, you have to know your body. There's certain days where, in that chemo cycle, day 2 or 3, I'm not moving. I can't plan anything this day. This day I'm going to be resting, and that's okay. So then you do it on the days that you can, right? And that's sort of the point. It's not pushing yourself to the point of pure exhaustion that you can't do anything, but it's also trying to recognize when I have the ability to go for a short walk, can I get out there and do it? What does that look like? And does it make me feel better after? So when we look at benefits after treatment, we see a ton of those same things in terms of strength, balance, quality of life, mental health, but we're also seeing these changes in some of those levels. So that insulin, there's these levels called insulin-like growth factors.
You know how it goes.
Oh, there's Dottie. Okay, she made it. So insulin-like growth factors and binding proteins. And what we see is if we have high levels of one and lower levels of another, we have less risk of cancer recurrence. And so exercise is improving these levels for us as well, decreasing recurrence risk and improving survival. And that's pretty much the last part here, is just to kind of look at how can exercise actually help to prevent recurrence and improve survivorship. So this study was done in 2013. So it's really old actually at this point. And we have so many more studies at this point to even help kind of solidify the importance of how much how exercise can affect our survival rates in cancer. Do they affect every single type of cancer? No. Unfortunately, a lot of our blood cancers don't respond in the same capacity as to exercise as some of our breast cancer survivors. So because it's just the type of cancer, it doesn't mean that it doesn't improve other things, right? So it can still improve quality of life and mental health and strength and being able to do the things that we love for longer. But can it necessarily impact mortality or recurrence? Not necessarily. So there's only, we see this in breast, prostate, GI, ovarian, glioma, lung cancer. These ones have a little bit more of an impact and risk reduction with exercise, especially breast cancer that has estrogen receptor positive tumors are really the most impacted by physical activity. And that can be as little as walking 3 days a week for 30 minutes at just like a moderate pace. So you're still able to carry on a conversation, but you might be a little bit breathy. And so we see that exercise, again, has huge benefits in our individuals that have hormone positive tumors in breast cancer. This study is much newer, and it just helps to see that, does it matter if we exercise before or after? And really, we're seeing that post-diagnosis exercise matters more. That's ultimately what they found. And the risk varies, the risk reduction varies based on study, but it's at least 26%, across breast, colorectal, and prostate cancer. So we're seeing quite a big reduction in risk of dying of cancer, but then it's also helping all-cause mortality. So if you think about, when you exercise, you're improving your heart. So you're going to have better blood pressure. You're going to have a less risk of stroke or high cholesterol. So all of those things are also going to be affected and improve survival because you're, exercising that way too. The one thing that they found throughout all these studies that got published in 2019 and 20 was really the increased risk of melanoma. So this was actually the only cancer that wasn't positively impacted by exercise. And you could imagine why. It's mostly because a lot of people are exercising outside in the sun. And so there is this increased risk of melanoma. So the American Cancer Society is really pushing, to make sure that we're using sunscreen or covering up when we need to, wearing hats. So that way we can ultimately try to reduce that risk while improving the benefits across all the other cancers. Okay. So I'm gonna letting Megan take over right now just to talk about, okay, so now we know it's good. Exercise is great. So how much do I have to do? And do I need to be at the gym going crazy every single day? It's too much. These memberships are so expensive. So I think Megan's just gonna talk a little bit about, what are the exercise guidelines for cancer survivors?
Yeah, so like Jill mentioned, we're going to dive a little bit into that. And before we go any farther, there's no need to go out there and get your gym membership yet. There are plenty of other ways, like she had mentioned before, to do everything you need to do at home, outside, wherever you'd rather be. So first, we just have a graph on this slide, and it's going to display the amount of research and evidence that's been completed over the years regarding exercise oncology. And so as you can see, it has been growing exponentially in recent years. And this is just really exciting and promising because it's led to some really great understanding of the connections between physical activity and the benefits for this population specifically.
Did we lose Megan?
I think she froze on us for a second.
Oh,
Hopefully we can get her back.
yeah. Give her a minute.
All right, Megan, you'll come. I think you're going to chime in hopefully in a second. You're frozen on us. Sometimes she can still hear us. So just let her know. I'll cover for her for a minute till she comes back. Okay.
Okay.
So what we found is that ultimately the American College of Sports Medicine has always recommended, well, she'll be back in a minute. I bet she's going to log back in. So the American College of Sports Medicine has always recommended us doing what they say 150 minutes of exercise a week. That sounds like a lot and also really hard to conceptualize. And so although we still recommend 30 minutes of aerobic exercise 5 days a week, that's the ultimate goal, we're finding that 30 minutes 3 days a week makes a huge difference, and it has a ton of health benefits that we can all still benefit from. So it's okay if you can't hit the full 150. The other big thing they make sure to point out here is just to avoid inactivity. So there are weeks where life gets in the way, we don't have a lot of time, or the cancer treatment is just kicking our butts. So in that case, the goal is really just to try to avoid inactivity. It's okay if you're not meeting 30 minutes 3 times a week or 30 minutes 5 times a week. But what we find is that the best benefits are seen with at least 3 times a week of 30 minutes of aerobic activity. And these studies have been done from anywhere between 8 to 12 weeks long. So I'm just checking if Megan's made it back in yet. Not quite yet. So what we also think about is the intensity level. So we want you to enjoy yourself, but a leisurely stroll is probably not quite intense enough. We do want the heart rate to get up a little bit. We want the heart rate to beat so that we can send the oxygen to the brain and our entire body and really get it pumping. So when we say moderate intensity, we're saying that you could still talk and have a conversation, but it's breathy. You're let me get up this hill and then we'll finish that conversation, those kind of things. If we think about it from a scale, 0 to 10 scale, 10 being, oh my gosh, like this is insanity, like take me to a hospital, I can't do this anymore, it's so high, versus a 0 would be like sitting and just breathing. You want to probably be between a 6 and a 7. Okay, so a little bit over that halfway point to try to get you there. And then we are still recommending resistance exercises twice a week too. So we'll show you a couple of our favorites at the end. And some of those are simply like standing up, sitting down, standing up, sitting down. Those are squats. So doing those regularly can really help your quads, and they really help your glutes. They help your core. And we always want to, it's really important for us to try to live our life and be able to stand up without using our hands. So that is something that we're really gonna, hope that you have enough balance throughout most of your life and strength that you could stand up without having to push up on the armrest of the chair. That would be really helpful for yourself. So, just think about challenging yourself in that case, and trying to do 10 of those, every day. That's part of an exercise. So the other thing that, I have the chat over here that you're looking at. So then the next thing is that how many people actually do this? Not many, right? Like 1 in 3 people is probably actually meeting these physical activity guidelines. But what we're also finding is any setting works. They do find better outcomes with supervised programs. So things like if you are working with a physical therapist, if you have a trainer, if you even just have a friend, that buddy system to help hold you accountable. And then we also see benefits when you're also helping yourself, not just from a physical perspective, but also from a social, mental health, nutritional perspective. So the more multidimensional you can get in improving your health, the better you're going to be, the more benefit you're going to have from this exercise. And then also the more likely you're going to stick with it. Okay. But you don't have to be doing it in a gym. And that's what they find. Nothing says that a gym is better than anywhere else. Okay. So then aside from the general exercise, prescription, Lachlan's going to jump in here now, but we do really want to consider some of the precautions that you might need to take, because there are considerations that you need to have when you're going through treatment. After treatment, there's certain things that you can be doing based on your type of treatment just to help you kind of stay on that trajectory upwards. So Lachlan, I'm going to have you take over now.
Okay, so what we're going to be diving into, and like Jill said, is talking about some specific cancer treatments and how you may need to adjust accordingly. And of course, with this, we're going to be focusing on, if you want to go to the next slide now, some of the more common, more well-researched ones, keeping in mind that some of the newer treatments that are more individualized, it's harder to sort of understand the full scope of the effect that that will have on your body. So with this today, we're going to talk about some of the more general ones, and hopefully that will spark a conversation for you to have with your oncologist about things that you may want to keep an eye on in your own life so you can then get the proper assistance to manage those. So looking at this chart, some of you may feel that you're represented here, may have very intimate knowledge about experiencing some of these side effects. And one important thing to keep in mind with these is that some of these sort of late effects you may not see until 5 or 10 years after you have been diagnosed, after you finish treatment, because of the amount of time that takes for all of these to sort of like work through your body and show those effects. So you may have stopped treatment in say 2018, but now in 2022, you're starting to feel more anxiety, more fatigue, you're having a hard time moving around and all those things. And that doesn't mean your treatment didn't work or that there's anything wrong with you and how you went through your process. It's just that it just takes a toll on your body. You went through a very, very significant change. And so hopefully with this, we can show you some things that can help you improve in those areas. So if you want to go to the next one. So these long-term side effects are not uncommon by any means. A study looking at survivors who were more than 5 years post-diagnosis found a very significant percentage of people who were experiencing poor health, limited function, and all of that will impact their ability to be able to do hobbies they enjoy, to work, take care of their family, and really achieve everything that they want to in life. So obviously being aware of these different effects is going to be very important to manage all of those. And now here is the list of ones that we are going to be talking about. So we'll just dive right in. So first one is radiation, a very common treatment with different forms of cancer. And the main effect we're seeing that it has on the body is decreasing your range of motion. So how much mobility you have at various joints in your body. Specifically, we're seeing peaks at 1 year post-treatment. So as you are moving through, you'll start to feel like less and less motion. It may become more painful to move around. We also see some heart and lung changes as well that are really important to monitor. And so with this, one of the key things you can do is just stretching, getting that joint moving. If you are able to maintain stretching, they found for a year, doing a consistent program with that, then you've been able to really maintain that range of motion, and then you're in a good place going forward. So that can be just very simply done just throughout the day, making sure you're moving and trying to really keep your body going. You'll be able to maintain all of that. So again, it's shown, you can see here, lung cancer, breast cancer, all those things have really seen a positive impact with this. And like I was saying, to be able to maintain contact with a cardiologist or other healthcare provider to keep an eye on those other effects as well. Okay. And then the other big one is depression and anxiety, because of course you or a loved one you have experienced one of really big scary things in life of going through cancer. So there is that aspect, but also it's been found that there are true chemical changes that happen in the brain that then cause those feelings of depression and anxiety. And so that's something that can be treated and can be helped. It's been found that anxiety is more common in those early stages of a diagnosis. So when you're going through those initial stages of this huge life change, and depression is something that more follows through that whole way, even up to 12 years after a diagnosis, especially with younger or middle-aged survivor groups. It's been found to have higher levels of both depression and anxiety. And so with this, similar to treating someone who just had a hip or knee replacement, there are things that you can do moving your body to help decrease these symptoms. So that can be things including sort of aerobic training. So getting up and going for a walk or doing other activities that you enjoy, trying to keep it similar to what we said earlier, 3 times a week for 30 minutes has been shown to have really great improvements in symptoms. Combining this with resistance training can also help as well. Though we did find that resistance training alone was not really enough to have these effects. So you really need that aerobic component of really getting your blood pumping, your heart going, and all of that to have a good effect. And additionally, it's been found that 80% of patients with cancer who have psychological issues, those have gone undiagnosed and therefore untreated. So if you're feeling any of these things, it's really important to talk with your healthcare provider about it, because there are things that can be done to help you so that you don't have to continue to feel this way, because I've already been through more than enough. So it's great to know that these resources are out there to help you feel better. Okay, next one is bone marrow suppression. So your bone marrow is where all of your blood cells are formed. So your red and white, and those both have very key functions in your body. And unfortunately with chemo, that will sort of suppress that production of these blood cells, which can then have various effects in your body. Typically we find that during your chemo cycle, between day 7 to 14 is when this is suppressed the most, and you'll likely see these impacts are strongest. And so because of that, it's really great to talk with your oncologist if you're going through chemo to try to figure out what your cycle is, so you can be aware and sort of plan for those peaks in suppression. So then we'll talk about specifically what those are. So white blood cells, they help to prevent and fight off infection. So when you're in that peak suppression, you may want to avoid working out in larger spaces or going towards large gatherings. So maybe switching your physical activity to something in your home or in your neighborhood where you're still out and about, but maybe not around as many people. So teletherapy, virtual personal training sessions are great ways to still be involved. And then additionally, your platelets, red blood cells, those carry oxygen throughout your body, which is really important to keep your muscles going and have good energy. And so when you don't have that, it could be much harder to go on your regular walks. All you may be able to do those few days are just your general activities around the house. And that's totally okay. So that's also where you want to know your cycle so that you can plan when you maybe want to go on a hike around the community or go on a walk with your partner so that you can best maximize your energy. And then going along with this, we'll hop to the next one. So cancer-related fatigue on the next slide. Yes. So this is another very common symptom. It's one of the most often reported by people going through chemo and radiation therapy. So this is more than just feeling tired or done at the end of the day. This is a very persistent, distressing feeling that patients go through of just pure exhaustion. There's nothing you can do to really get them moving. And so with this, obviously, there are some things we want to be able to do with this to try to help alleviate this as much as possible so that you are still able to have a good quality of life, even if you are going through these symptoms. I'm going to hop to the next slide, please. So energy conservation is key. So that may be trying to set up a calendar of like, what are my priorities? What are things I have to do versus what can I hand off to someone else? And even though you may want to get everything done, it's totally okay to ask other people for help, to get more people involved, as it's a way that they can also show support for you as well. And giving people around you a task also really helps them feel like they're doing something positive for you while you're going through cancer yourself. Limiting naps, as much as we all may love taking a nap, trying to sort of get your body regulated of when is the right time to sleep can also help to control those feelings of fatigue. And just adding in structure to your day. Like Meg and I, students right now, our sleep schedules are all over the place, and that really affects our energy levels. So same thing for anyone really. And the more you can sort of add structure to your life, the better your body will be able to tolerate all these other things being thrown at it. And so similar to before, aerobic exercise, great way to help sort of keep your body going. Found also combined resistance training can be great. So you can tackle sort of all these different things at once just by doing like one exercise program, which is a great thing as well. You don't have to do too many things adding on to everything else you're already trying to do in your day. Okay. So next one is chemotherapy-induced peripheral neuropathy. So very big fancy title. Essentially what that means is that you are experiencing loss of sensation, maybe having pain or extra sensitivity to touch or pain, specifically in your hands and fingers and in your feet. And so this can have some very serious complications that you want to be able to keep an eye on, including balance deficits. So if you can't feel the floor, you're more likely to then fall. Fine motor, so being able to use your hands for writing or cooking or other activities like that. And so all that combined can then decrease your quality of life. So being able to recognize those symptoms for yourself, you can then be able to share that with your doctor and be able to get some help for this. There are some medications, but unfortunately, they don't really help improve all of the symptoms, especially in those like loss of sensitivity and sensation. But going to PT for balance training can help improve safety in your home. Also thinking about minor changes you can make around the house to create a safer environment. So night lights when you have to get up to get some water at night, trying to reduce clutter and throw rugs. Also wearing supportive footwear and keeping shoes on when you're in the house can also help to keep you from stepping on something, maybe getting a cut and not realizing, and causing a whole sort of cascade of events that you would definitely want to avoid. Next one, incontinence. So I know this one can be embarrassing, often something we don't want to talk about, though it is a very key part of our lives. You know, if you are someone who is dealing with incontinence, you may not want to leave the house and go out because you're worried about where you might find a bathroom. And then if you are sort of stuck to your house or your job, then you're not able to do things that you enjoy. And that will obviously then sort of tank your quality of life and enjoyment. So this is found to be fairly common with radial prostatectomy. The prevalence of this is sort of all over the board with reporting. That could also be, again, from that embarrassment of people not wanting to talk about, not wanting to seek help. So feeling empowered to ask those questions, say, hey, this is what I'm going through. Like, what can I do about it? Because there are things that can be done. One great resource is pelvic physical therapy. We have multiple providers, we're very lucky too, in this area that can help you with all of this. So doing Kegels, pelvic floor training, pre and post, if you know that this is a type of treatment you may go through, all of that can help to improve continence and be able to just be able to go out of your house and feel confident in doing activities throughout the day. Next one is lymphedema. So this is swelling in various body parts, typically due to changes in your lymphatic system. So that is the system in your body that helps to move various fluids around, similar to how your like circulatory system works with your blood. And so this is often something that we see with breast cancer survivors, often with mastectomies, when you have lymph nodes removed, and that impacts the flow of the fluid throughout your body and then can lead to that swelling. So it's often a slow progression that appears over time, and especially can happen if you really ramp up your activity. So if you are the so-called weekend warrior, or you're doing your normal day-to-day activities through Monday, Friday, and then Saturday, Sunday, you're hiking every single waterfall in the town. And then at the end of that weekend, you start to swell up maybe in your arm or in your leg. Unfortunately, with this, it's hard to completely get that swelling to go away. So prevention is very, very important. You want to reduce your risk of infection as well as reduce that swelling that can happen. So trying to build up slowly in the amount of exercise you're doing, or even like Jill was saying earlier with gardening, if that's something you really enjoy doing, starting off with maybe 30 minutes here and there, and then progressing to an hour, and then so on from there, so that your body can better tolerate all of that, is a great way to help prevent lymphedema from sort of getting beyond where it can be easily controlled. Okay. Down to the next one with osteoporosis. All right, so osteoporosis is this sort of thinning of the bone. So if you think about a sponge, all the holes it has, that's sort of what happens with your bones, which can then increase your risk of fractures and other really significant complications that are definitely best avoided. This can be caused by a variety of different treatments. So hormone therapy, menopause, which could be caused by various treatments themselves, radiation, and then other certain types of cancers themselves will then sort of attack the bone tissue as well. So if these are things you've experienced, it's really important to go through routine screening so that this can be tackled earlier on. All right. So luckily there's lots of research on how to sort of combat osteoporosis. Strength training, especially body weight resistance training, is really great to be able to improve bone health. So we talk a lot in our classes about how just using your body, putting stress on your bones just through day-to-day activity, general weight training, all of that can really help to build up your bone strength and be able to reduce your risk of fractures and falls so that you can avoid all of those effects that would come along with that. Okay. Next one, cardiovascular disease. So this includes stroke, heart failure, as well as other heart conditions. This has been higher in survivors who have various types of cancer that affect either the heart itself or near the heart. So for example, breast cancer, any treatments directed right at that area are also going to be directed essentially right at your heart tissue as well. And so then it will experience negative effects along with the tumor itself. And unfortunately, we find that 46% of patients are not being properly monitored, even if it's already known that they are at risk for developing these conditions. So it's really important that you do, again, speak with your oncologist, speak with your regular doctor to know if this is something that you need to have monitored to be able to avoid these worse outcomes down the line. All right. So again, like this is sort of can be all over the place as far as when you start to experience those symptoms. So like we talked about earlier, 5 to 10 years post-treatment with radiation therapy, you'll start to see changes to the heart muscle itself, as well as the arteries. You might see hardening, which will then impact blood flow and everything else. Even children or adolescents with cancer may see issues 20 to 30 years down the line as their heart matures, as their body changes and everything else. We found that low intensity exercise during chemo can be protective and help to keep the heart safe, functioning properly, and help to sort of reduce these effects down the line. All right, so with this, like we were saying, making sure that you are speaking with your doctor to know if you need to be monitored for this. If you are working out in a gym or other fitness facility, asking someone to monitor your vitals before, during, and after exercise can be a great way to help you keep track of any changes or know of anything that you should share with a doctor. Then using something called the exertion scale or the Borg scale can be a great way also to track your intensity, especially if you are taking medications that may sort of suppress or control your blood pressure and your heart rate, because then those measures aren't really effective for letting you know how hard your heart is actually working if you're being sort of controlled by these other mechanisms. So this scale works, you can see the numbers on it, 6 to 20. And so that just sort of gives you an idea of how hard you're working, from like very little to sort of more intense, has images as well, sort of help you understand how hard you're working beyond just what do the numbers say. This may give you a more accurate impression of it. All right, so then just, brief sort of summary of all of that, big things you want to keep in mind. So with osteoporosis, any sort of big impact to your bones are things we want to avoid. So jumping or other really fast activities may increase your risk for falls or fractures. So working on balance training or more gentle activities can be better to protect your bones. Lymphedema, remembering that gradual progression, going and seeking care from a lymphedema specialist to help control swelling and also apply compression mapping are also great ways to control all of this. Incontinence, doing Kegels, seeing a pelvic floor specialist or other healthcare provider. If you have a history of radiation, stretching, really thinking about those joints that are closest to where you receive treatment, and also monitoring your heart as well for those changes. And then if you have a compromised immune system, remembering to clean equipment when you're using a gym, wash your hands regularly, and all of that to help protect yourself. And then finally, cardiovascular disease. So looking for signs that your heart is working too hard include shortness of breath, feeling lung congestion, and also checking your vital signs as well, using that scale that we talked about. In addition, can help you sort of keep track of all of that. So fatigue, aerobic or aerobic with resistance can help improve symptoms and keep you going longer. For that neuropathy we talked about, that decrease in sensitivity, doing balance training, thinking about safety and how you can prevent falls are all key for that. And finally, anemia. So this may be a time where you feel that reduced exercise ability. So really thinking about how to conserve your energy, monitor your vitals, and maybe do more activities that don't aggravate your symptoms as much. All right, and I think we're gonna hop back over to Megan if she made it back in.
I did. I'm back. I'm so sorry for that, guys. I live in on-campus housing and the internet just decided it was done. So that's all right. We drove to campus. I'm here now, so we should be good. But so I'm glad I can be back here to finish up the PowerPoint with you, and we'll talk about our last objective here, which is what is the PT's role and how can they help you? After all, that's really what we're looking at here, is what can we do for you? So moving on, there is a really long list here, and that's because we can help you in so many ways. Included on the slide is really just a short list of all the different things that physical therapists can help you accomplish. Like I know it was said earlier, PTs take the time with you to determine what your goals are and what the best ways to go about accomplishing those goals would be, because it's really about you and what you want to get out of your treatment. So with that in mind, it's really important to remember that nobody knows your body best except you. And so with that being said, you have to keep that line of communication between you and your physical therapist really wide and open. So if you don't like something, or if you really like something, tell them. If something's too hard, too easy, just let them know what works best for you. Even though they are truly the experts in movement, you are the only expert in how your body moves and what's best for your body. And so like you can see, those are just a small list of the goals, from developing healthy habits, regaining independence, pelvic health PT, and so many more. And then, so here are just a few questions for you to consider if you're thinking about that maybe a PT could be right for you. After this PowerPoint, how could you not think that we could help? So just some of the questions listed are, do you struggle with balance? Because that can be really common for some of the reasons Lachlan discussed. Do you have any pain? Do you have any goals to reach for? And you can read the rest, but if you answered yes to any of those questions, you should really consider looking for a physical therapist. They're really great ones in your region, in this region, really anywhere you go. They are trained to support you in any of the subjects listed and really to help you reach your goals, whatever they may be. And then, so for our summary, we have that physical activity is good for everybody. And so, but with that being said, it's important to consider the type and the treatment and the side effects that may be encountering to help you target what type of exercise would be best. And then, so the recommendations for physical activity that were presented would still be unattainable for many cancer survivors, especially during treatment. So like we said before, you know your body best, listen to what your body is telling you.
Great, thank you all. And I'll just add too, so one reason we also put a plug-in for PT is because it's typically covered under insurance with a copay. And so some of us will have, anywhere, $20 copay. My copay is higher for pelvic PT just because it's considered a specialty. So I know my personal copay is $40. But I only had to go 2 or 3 times to get exercises that I needed. This was post-pregnancy for me. But my father-in-law had prostate cancer and I sent him to one. So, and it was 3 sessions that he was able to get the exercises he needed and then go home and do them. So sometimes it can just be a matter of going to the PT, telling them exactly what you want. Like Megan said, I want an exercise program that I can do at home that's going to benefit me and help me in the long run. They might have you come back in a week to teach you all of your exercises and then not come back for a month just to see how you're doing. Definitely helps having some level of follow-up. It holds you a little bit more accountable, but that way you're not necessarily having to pay the gym membership that can be super costly. So that can help as well. So we do want to open it up to any questions that you have. And then we were planning on showing you like 4 of our favorite exercises that are pretty safe for everybody to do. So if you have questions, you can, we can ask those now, or we can wait until we show you the exercises. Does anybody have a preference?
Show us the exercises first.
You got it. Okay. So do you want it, Lachlan or Megan, do you want to go through these? I also brought the band for like scap retraction. So do you want to start with sit to stand?
Yeah, so I was the one who did this slide. And so this one is a really great exercise for anybody, really. It's really important to keep that ability to be able to sit down and then stand back up. So I have some figures down there included, but so the main gist of it is when you're going to be seated in a chair, you're going to want to scoot forwards all the way to the edge of that chair. And then depending on the level of support, you can really personalize this exercise, whether you want to go no support with your hands out in front of you, so not using your hands, and stand up. You can put your hands on the arms of the chair, or you can just have your hands on your legs. And so it's really progressive. Like say maybe one day you're not feeling that great, so you put your hands on the arms of the chairs, but then maybe next week you can go all the way to no hands. And that's really up to you. You know your body best. But so how many times our goal for this is you want to try to do 5 to 10 repetitions twice a day, every day, just reinstating how truly important it is to keep this ability alive and thriving for you.
Great. Yeah. Thanks, Megan. Another good one is, having the ability to get up off the floor. That's another important skill to be able to do. And we actually can attribute that to, we've seen people who have longer life expectancies actually, who can get themselves up off of the floor, right, for longer in their life. So kind of maintaining that strength and mobility to be able to do that. And this exercise can also help with that. And it's safe. It's something we have to do every day anyway. But I'll tell you, when you do 10, when you get to 9 and 10, you're feeling it. And your heart rate should come up a little bit. And then take a short break and do that second set. And you'll actually notice your legs and your butt will get a little bit perkier. So it can have positive benefits from that sense too, from just from feeling stronger and having that as well.
So this is our next exercise, which is really great for everybody. And it's scapular retraction, which is a fancy way of pulling your scaps together. So that's all we're going to be doing for this. And so it's best to do it either standing or sitting, but make sure you're sitting up tall. So you're sitting up straight, and then you're going to have your elbows bent and your palms facing you. And then you're going to pinch your shoulder blades together. And then you're going to bring them back. And then you're going to pinch them. So you can kind of feel like if you were to put a pen in between your shoulder blades, you'd be able to pinch it and hold it back there. Yep. And then another option to increase the resistance or the difficulty is to take one of those resistance bands like Jill has, and you're going to hold it in between your hands. And when you pull them apart, you're going to pull the band apart. So rather than just moving your arms, you're going to have that band that you're physically pulling apart to squeeze your shoulder blades together.
So you would tie it to like a doorknob, or right now I have it actually tied to my chair, just the armrest of the chair, and I'm just pulling back. One thing with this exercise is you just don't want to shrug your shoulders. So you don't want to be coming up like this when you do it, or you're going to end up with neck pain and headaches. So you want to make sure your shoulders are down and back, and then you squeeze those shoulder blades together, like Megan said. And you should feel resistance on that the entire time. So if you have any of these bands, they're really helpful. I find a lot of exercise equipment at Five Below. So if anybody has seen that store, there's one in Ithaca, and they're like $3, for bands. They have yoga mats and all sorts of stuff too. Oh, Lachlan, there you go.
Yep. All right, so the next one is the pec stretch, where the muscle that sort of goes along your chest here. So like we were saying earlier, this is great, especially if you had radiation, breast cancer, to sort of keep this muscle going. So you'll start with your arm sort of against a doorway, like you see in the image there. Then you'll step forward and you'll feel a stretch through your shoulder and your chest. And with this, we want to go to feel a light stretch, not pain. We don't want to force it back as far as possible. Hold this for about 10 to 20 seconds, depending on what feels comfortable for you. And we want to do this 3 to 5 times per day to, again, keep your chest wall open, improve breathing, improve range of motion, all of those things.
Yeah, I'd say hold for 30 seconds at minimum, just to really keep that. It takes a while for the muscle to truly relax. So that last 10 seconds, so I would say a lot of people only hold for 15 to 20. And then the muscle doesn't really get a chance to truly stretch. So that last 10 seconds is really important. And 30 seconds does feel a little bit long, but then you can get away with doing it 3 times too. So if you do 3 times a solid 30 seconds, you'll actually, over that last 8 seconds, start to actually feel some shift in movement. We give these two exercises specifically, the retraction one, where we're pulling our shoulder blades back, and the pec one to a lot of patients with any type of breathing difficulty, people who've had COVID. Really what we want to do is open up the front chest where we're able to breathe. Okay, so the more we can open this up, the better we can breathe and oxygenate. And so anybody with COPD or pulmonary issues, COVID, a cold, pneumonia, and then of course, like Lachlan said, any other radiation, but we call it posterior strengthening. So we're strengthening our back and stretching out our front. And you think about sitting, you know, so much of the day, we're always the opposite of this. So we're always kind of sitting forward and hunched. So again, this is a great postural exercise too. And you may even notice benefits kind of going up and down the chain of your body, just feeling better from a neck standpoint. If we can improve posture, we're also able to often raise our arms higher. So if you're really flexed forward, that's about as high as I can get my arm. But if I sit up tall, I can get my arm all the way up. So those are some of the things that we'll notice as well.
All right. So the last one is walking. So I'm sure you all remember, we talked about this multiple times throughout the presentation of this is a great way, cheap way, free way even to be active and get some physical activity into your day. So just to reiterate, it's found recommended that 30 minutes 3 times a week, maintaining that for several months before, during, after treatment for the rest of your life. Everyone should be walking is a great way to improve general health and reduce lots of different symptoms we talked about today. So of course, keeping in mind, again, like Megan was really reiterating, you know your body. If you are going through sort of a worse time with your treatment or you have a lot going on, you may need to adjust this based off of what your body allows. This is also a great way to have some social time by going with your partner, your neighbor, other friends, or even just having some time for yourself, just to sort of take a break and just go out, see some nice nature before all the snow comes.
All right, so those are our main exercises. Would just be the walking, and those that one stretching and the 2 strengthening. Those are our favorites. There's of course more that would be more individualized to you and more appropriate. If you have exercised before and you're comfortable, nobody's saying that you have to go and see a physical therapist. Just gradually get back into it and monitor yourself for any type of pain or shortness of breath that you might be experiencing. So, but otherwise you are safe to get back into it. You will not increase your lymphedema. You won't really, if anything, you're going to improve your quality of life and reduce the risk of cancer ultimately, or a recurrence. So any questions about anything?
I have one question. I am a breast cancer survivor and I do have lymphedema that is pretty well managed. Does the pec stretching help with lymphedema?
It doesn't necessarily help with the lymphedema itself because it doesn't really reduce, it doesn't give you any of that pressure that you could use or that you could benefit from, but it does keep your shoulder more open. It improves the breathing, and in time, technically, if you can not let that get too tight, it doesn't restrict the fluid as much either. But I don't have a direct correlation, so I can't say yes for sure, but keeping yourself loose and open does allow a better flow for the lymph to drain, especially because you have them all in the axillary region. I don't know if you've probably had some taken out, and that's why you have the lymphedema, but it has to find somewhere to drain. So you're thinking about it going down here, or through the armpit. Sometimes it'll go over the back and try to head down that way. So anything you can do to kind of keep yourself a little bit looser in the shoulder region won't hurt you. Just don't, watch yourself you don't want to be too sore, go to the point of resistance, hold there for 30 seconds, and then try it again. Don't cause yourself pain.
All right, thank you.
Mm-hmm.
Oh. I have a question. I have another question. I'm here with my husband, Tom, and he has a glioblastoma that he's doing well with. And he walks about 5 miles a day. And I believe that has really helped tremendously. But are there other exercises that you find would be useful to somebody recovering from?
Yeah, so GBM is a tough one, right? I mean, you both know that.
Yes.
So I'm a neuro PT, so that's mostly what I've seen more of from the neuro realm. So I specialize in neurologic disorders. So a lot of things that is focused is just maintaining that activity level. It's huge. I think you're 100% right that the oxygenation that you're getting to your brain by walking every day is really, really helpful. And then a lot of it comes down to managing what is happening and trying to just be as functional as you can for as long as possible. So we do a lot of balance training, a lot of core stability too. So if we can be strong in our core and our trunk, it's easier for us to keep walking. It's easier for us to maintain our balance when we're moving. Doing what you can, I think, is really valuable. If you were to have like an exacerbation and something, got worse, or a side effect of a glioblastoma that's affecting other parts of the brain, rehab is really helpful. There's a neuro PT in town, and she's up in Lansing now. Another pretty good place in Seneca Falls as well for a neuro PT. Kind of also just trying to keep that, I like to call it dual task. So Tom, be cautious, watch when you can't do it anymore, but being able to carry on a conversation while walking, being able to carry a cup to the kitchen is honestly a dual task. So you're holding a cup of water, balancing it, walking, and putting it there. Even thinking about things like, I'll play the categories game with individuals. So we'll walk, and I'll say, all right, name a bunch of fruits. Now, don't repeat the same fruit, just to kind of really get your brain challenging while walking. Because walking is an automatic task, but as the disease progresses, you might have to start thinking about every step. And so you want to try to keep challenging your brain and the walking system at the same time while you still can.
Great.
Does that make sense? So we call it dual tasking. So trying to do two things at one time, which I know sounds, silly in some ways, but we take it for granted, being able to chew gum, carry a purse, walk through a crowded store, and then pick up groceries, follow a list. But all of those are really high level cognitive skills that are requiring you to navigate an environment, think clearly, walk, maintain balance. So I think that getting out and kind of keeping your brain fresh is also just another thing that can help you keep going on a positive trajectory.
So the question I have is about balance. I mean, I have a little bit of imbalance, nothing big where I fall down or have trouble walking in fairly straight lines, but every now and then I may walk on a slight slope to the side, and I'll start walking to the side. I don't know if that's imbalance or what, but it feels a little bit funny. Any suggestions with that?
Yeah, it can cause you. So it sounds like, a couple things. There's the vestibular system could also be involved, which helps your balance. And that's all in the brain and in the inner ear.
Right.
So there is, actually the person who's just opened a place in Lansing right now, she actually specializes a lot in that too, if you need me to give you that information in the chat. And I'm not just promoting her, I just know that they just opened and they're do work on their big thing is balance, like that's their focus. But
right.
Balance has a lot of different causes and reasons. So like our balance is composed of our ability to react if somebody pushes us, react if the surface changes and be able to take a step. Balance is, the ability to just reach for something overhead and not fall. So it sounds like your balance issues are really only happening when you're moving, right? Is what it seems like, not when you're standing still.
Right, and it's not all the time, and it's not terribly obvious, but every now and then I'll see if I'm walking. So there are these gutters on sides of the road in our subdivision. So if I'm walking in the gutter, I may walk into the gutter, kind of like not paying attention, but just, you know, and it feels a little funny. And then other areas, when I walk through a very wooded area, I may get a little imbalance when I'm walking in there because I'm picking up things from the side, visual issues.
Yep.
And, you know, but once I get out in the wide open, that kind of goes away. So that's what's going on. I don't know the exact reason or the name for it, but that's what I'm experiencing.
Yeah, it sounds actually like it might be a little bit of the vestibular system involved, which is, you know, can be helped. So it might help to do some activities so what we often prescribe for it is like the ability to look at our thumb out in front of us and keep our eyes on our thumb while we turn our head, right? So I have to do like a formal assessment, and you try to do this as fast as you can while keeping the thumb in focus. And it can easily and quickly provoke dizziness. So, you know, you do want to be cautious. It'd be nice to be monitored if you're doing it, but it sounds like sometimes that's why we veer. And also it does seem like there might be some visual things going on as well for you. So
well, part of this symptom of my cancer, I lost the ability to read. So, and then when I was at OT, the OT person had me looking left and right as quickly as I could, back and forth, back and forth. Yeah, and then after a while, I mean, I did well at that. I met the numbers she was looking for, but after a while, you know, it kind of hurts. So she said, keep doing it, keep doing it, keep doing it. And, you know, like a good person, I would be doing that, but I'm not always a good person. So, I do it every now and then. So I guess I'm getting to the point where maybe I should just take my own medicine and do it.
Yeah, I mean, it sounds like she gave you some visual strengthening. So she gave you some eye muscle strengthening, which is helpful. And once you can get those eyes tracking well, you know, together, then that's where they'll track while you move your head too. And that's, you know, really the point is to try to be able to, that's kind of the next step up for that progression. But yeah, it can make you dizzy, and vision is one of our balance systems. Like if we take away vision, we're falling a lot because it's a huge system we rely on.
Right. Yeah, I've never fallen. Just going back and forth. I think I did 30 or 40 times and then it started hurting. So maybe just do fewer times and build up to that. I don't know.
Correct. Stay under your threshold for sure.
Okay. All right.
Stay under your threshold and try to, you know, make sure you catch the target each time too. So like if you have them out here, you know, that you are able to focus on each one as you move your eyes side to side. Because what happens sometimes, the eyes will overshoot, right? And they'll go too far. And so you want to make sure that you're strengthening them the right way, and you don't want to be seeing double either.
Yeah, that was her. She set up things to look at and go from one to the other, one to the other, one to the other.
And as you get better with it, you can challenge yourself by doing it in standing. So like you can start by doing it in sitting, then try to do it in standing, then try to do it with like a narrow base. So your feet are really close together. Position yourself near the counter or the wall so you could hold on if you needed to, but you can find ways to sort of progress it yourself as well. So it kind of correlates more to what you're doing, like a hike in the woods. You know, that's a lot more intense than sitting there, you know, moving your eyes back and forth. So you can start to challenge yourself at home.
I think the walking through the woods is just, I don't know if that's ever going to fix itself, but there's, you know, you see things move a little bit on each side. Not bad, but when you get out in the clear and there's not as many different things to look at, all that stops.
Yeah, and the leaves are a big one. So like as the leaves all fall and change, it's going to get really hard to walk through the woods.
Okay.
It'll really throw you off. So just be careful to maybe avoid the trails when the leaves fall.
Funny thing, she gave me the same test looking up and looking down. I did it. I must have done it really well. She says, forget it. You don't need that. Just do the other one. So okay. Left to right. Okay.
Yeah, that sounds good.
All right. Thank you.
Yeah. And if you notice any more balance things happening, I would just recommend like getting her script and headed to PT for balance training, because they'll do things like push you over to try to get you to catch yourself. You know, they have certain systems too that they'll hook you up in. And so if you fall, you're not really falling, you're in a harness and you just kind of tip over. So, but the whole point is, if in balance training, if you're not losing your balance, you're not training. So they will really progress and challenge you and force you to lose your balance so your body learns how to correct itself.
Yeah, it's not bad enough for falling down or having troubles. It's just, it's there. You can feel it.
So keep walking. That's a good thing. Keep moving.
Thank you.
Any other questions? We love having you all.
Jill?
Yeah.
Hi. This is not so much of a question, but kind of observation. And it seems like it's new research that's going on relative to folks who have long COVID, either slightly or very, maybe a lot of it, in post-exertional fatigue. That so many people are suggested to do exercise that was so nicely presented today for all sorts of reasons. And they seem to be finding that for people getting back to doing exercises, that's even they may not feel like they have to pace themselves. They really have to pace themselves because the exertion can really make it hard for their brain to function as well, because it's using up so much metabolic energy.
Are you talking about for long COVID?
Yeah. So are you coming across that in research or anything yet? I mean, I noticed it myself for sure. And I didn't have bad effects from COVID. I had mild effects. But
I mean, I'm seeing that more recently. I don't teach the cardiopulmonary stuff, so I think they're seeing it more in maybe even Lachlan has a better idea, or Megan, who's doing, you know, taking those courses. But yeah, that's kind of a different ballgame where you know, people who were able to run a half marathon are now not able to get to the mailbox. Right?
Exactly. It's really something.
Correct, that post-exertional fatigue. And I think part of that comes from some disruptions of the autonomic system, where now they're not able to respond. The body doesn't respond in the same way that it did to an increase in heart rate or an increase or decrease in blood pressure. So it takes, I almost look at sometimes it like a concussion, like it caused their autonomic system to go wonky. And now they're short of breath. And when the heart rate goes to, you know, 80, or the heart rate jumps to 200 when they walk to the mailbox, which is crazy. So yes, for you, you're right. It's definitely a really gradual progression, unfortunately, and something that probably doesn't even feel natural for a while, because that would have never made you feel that tired or exerted.
And it can also, apparently, I'm feeling a little bit of it, but not much of it, I don't think, but of really having your brain doesn't function as well as it did before. The administrative part of the brain, whatever that's called, doesn't work as well. And those kinds of tasks that don't have to do with physical activity necessary, but just thinking, writing an email or something can be much more challenging.
Slow to process, and we call it like executive function. So very difficulty with those higher level skills, or finding yourself, you wrote an email and you said some really weird words, you know, in it after that you didn't mean to send out. Yeah, I think, you know, you look at it from a kind of a fog perspective, like a brain fog. And I agree with you. I think a lot of that might be related to not getting adequate oxygen to the brain. And that can also come from that autonomic disruption. So,
because for me, it's definitely a big change from just a couple of weeks before COVID, which was only a couple of months ago. Big change. So
hopefully you continue on the positive trajectory, Claire, you know.
I hope so. I expect to.
Yeah.
And this was very helpful.
Yeah, that's a plan. So good.
Thanks.
You're welcome. Well, we can hang out a few more minutes if anybody has questions, and anybody who's, you know, ready to go for it. So, but if anybody has more one-on-one questions, maybe Jen, you stop the recording, and then we'll be hanging out for a little bit longer for any questions you have.
Will you be providing this presentation